Hello and welcome everybody to another Live with Dr. McDougall live webinar. So this is exciting. This is not pre-recorded. I am Gustavo Tolosa here in downtown Dallas on a beautiful day. And we are very excited to hear Dr. McDougall today talk about the topic of cardiology and heart, something that interests all of us. How are you, Dr. McDougall? Are you doing okay today?
You know what? It's a good day here too. I keep thinking that things are going to get less busy, but they just keep getting more busy. Yeah. And I had planned to finish up today a newsletter on cardiologists acting criminally, but I wasn't able to do that. I got sideswiped by Mary into writing an article about small intestinal bacterial overgrowth, SIBO. Mm-hmm. And so I've been working on that for the last 3 or 4 days, and that'll be the newsletter for this coming month, which is April of 2016. Oh. So hopefully in May we'll get down to the cardiologists acting criminally in more details, and we'll do another discussion on this. As a matter of fact, after you hear what I have to say today over the next few minutes, maybe what you'd like to do is to get your favorite cardiologist to tune in, become part of the webinar. I'm sure if you ask Gustavo to put that favorite internist or cardiologist or bypass surgeon on the show with me, I'd be happy to have the interchange, the discussion, either to completely agree with what I have to say or to tell me I'm just full of it. This is a live webinar. We as I've told you, and I hope you believe me, we welcome controversy. We welcome people to come in and to correct any of the information that I've been giving and am going to give, particularly today on the issue of heart disease, which is a $100 billion a year business, at least. The hospital I used to work at when I first ran the McDougall program, which is St. Helena Hospital in the Napa Valley, California. St. Helena Hospital, an Adventist hospital. They received 80% of their income from heart disease. They actually asked me to donate money to build a cath lab. I said to them when they did that, I said, look me in the eyes. You know who I am. I said, I'm here to put you guys out of business. That's how much they really believe that heart surgery is valuable. And I know in this case, the money gets in the way of their vision. It's just hugely profitable. This businesses of heart surgery, and it's primarily heart surgery. And heart surgery comes in two major forms. One is where they split the chest open and open the chest cavity, and then what they do is they sew grafts. We call them grafts. These would be veins or arteries taken from other parts of the body. They sew them around blockages of arteries in the heart. And this is a major surgery. It was first performed with the public's attention back in 1968 at Cleveland Clinic. It had been done before that, but it had not been given much attention. And then the other way the heart surgery is done is a tube is passed, usually through the groin, but can be passed through the wrist. And a tube is passed up into the coronary arteries, and balloons on the tip of the tube are inflated, and the blockages in the coronary arteries are broken up by the inflation of the balloon. And this is called angioplasty, or anyway, angioplasty is usually the referral, the kind. And they're both very popular. And as a matter of fact, I would say the angioplasty is much more popular. When I first started in this business, it was actually 1968 that I went to medical school. That's the time when they did the first coronary artery bypass grafting at Cleveland Clinic. And so I had a chance to learn about it right from the beginning. And we were taught that the indications for having the surgery were, well, initially we were told it was to save lives. But then when they did the studies, they found out that it did not save lives, except for maybe in a small minority of people. And this is research brought out by the CAS study, the coronary artery surgery study. So the other excuse I was given for why people should have bypass surgery, which was all that was available then, was to relieve incapacitating chest pain unrelieved by good medical therapy. Now, you have to take all those words in mind to understand what's been going on. It's to relieve, incapacitate. That means you can't do something that you want to do. If you get chest pain climbing to the top of a mountain, you don't want to go up to the mountain anymore, then it's not incapacitating. Unrelieved by good medical therapy. Good medical therapy that I was taught in medical school was medications like beta blockers and nitroglycerin and calcium channel blockers. But good medical therapy really was, at that time, a change in diet. There have been many studies, and I have them, and those of you who have access to my published favorite articles, because you have taken the CME course or the CEU course that we give, you have access to those articles. You'll find articles that show doctors from major universities treating patients with narrowed heart arteries who have chest pain called angina with a low-fat diet and getting relief of that chest pain in just days in as many as 100% of people with reversal of EKG changes. As a matter of fact, it goes further back than that. Walter Kempner with the rice diet at Duke back in the 40s. He published data where you could show reversal of artery disease based on EKG changes back in the 40s. So really, treatment of this disease with diet has been known for, well, as I say, Kempner brought it out in the 40s, Peter Quo, Dr. Williams, anyway, many other doctors have published articles in the major journals. So I'm showing the way to get rid of the chest pain, incapacitating or not, is with a good diet, and that same diet reverses coronary artery disease. So the title of this talk is Cardiologists Acting Criminally, Part 1, because I'm going to bring out some other stuff later, is the first criminal behavior, in my opinion, is that patients are not offered the option of a good diet. If they do have blockages, and lots of people have blockages, like, for example, you take a person my age, 60, almost 69, with a cholesterol I used to have. No, let me not use myself, because my cholesterol is so good now. I'm way out of that category. Let's use Bill Clinton, our 42nd president. When he had his heart attack at age 58 with a cholesterol of 235, 80% of men walking around had similar blockages. So it's a very, very common problem, to say the least. And if you have a problem, a chest pain or shortness of breath, and you go to a cardiologist or somebody who's oriented in that direction, they're going to look to your heart. And if 80% of men at 60 years old with normal cholesterol levels have blockages, then how often do you think you're going to find a problem if you look for it? Well, anyway, the first criminal act, in my opinion, of cardiologists is not to offer them the cure of the disease. The disease is caused by the rich Western diet. It damages the arteries, the progression continues, and so on from the damaged arteries. Plus, we have known through work of many, many people, including Dean Orange and David Blankenhorn and Walter Kempner and so on, that this is a reversible disease. And for a cardiologist or cardiac surgeon or internist or family practitioner to fail to offer this basic, not option, this is not an option, this basic treatment to a patient would be similar to a patient with real chest pain, real artery disease, maybe even a heart attack, going in to see a doctor and the doctor failing to mention heart surgery. You know, you'd be sued for not doing that. But no doctor is sued for failing to tell a patient about the dietary issues involved in the cause and treatment of the basic underlying atherosclerosis or the chest pains that resolve. And I actually got an email this morning, this is the truth, from one of the, actually the man who's a professional who's very much involved in this. And he said that he believes the only way that this is going to change this aspect, this is just one aspect, we're on point number one, of failing to tell the patient the truth about diet, is going to require a lawsuit, some very public lawsuit where a doctor gets sued, and then other doctors will pay attention and say, this is important, I must tell my patients this. Well, all right.
Yeah, Dr. McDougall, let me just say something, because someone wrote me an email this morning telling me to please tell you that she asked her doctor about diet and heart health. And it was actually her cardiologist, and the cardiologist said, why tell people about eating a plant-based diet or put them on a diet? They're never going to do it.
Yeah, the patients are too stupid.
They're too stupid, yeah.
They're too stupid and too disinterested in their health to make a change in diet. That's what I was taught in medical school. I mean, this goes back 40 years. And the students are taught that this is part of our formal education, is don't bother the patient with things like diet. They'll never do it. They're too stupid. Mm-hmm. They're barely smart enough to sign the check at the end of the office visit and to take these pills. That's the attitude that students are given, and the attitude that persists in medical doctors' minds is that you, ladies and gentlemen, are too stupid and too disinterested to change your diet. You understand the sarcasm that's going on here, don't you? I hope you do, because I know somebody's sitting there thinking, oh, what's Dr. McDougall calling me names for? But that's how the business is practiced. Well, anyway, that's point one. Point two, where I think that cardiologists should be brought to account. Let's just stop using the word cardiologist acting criminally, because some people think I'm getting, too out of bounds. So just to say, from this point on, they should be brought to account, is the fact that patients who undergo the open heart surgery using the heart-lung machine, the pump, they suffer serious brain damage. 100% of them are brain damaged. Mm-hmm. And a study done in the New England Journal of Medicine showed that after 5 years, about 40% of the people who had been on the pump showed a 20% deficit in their intelligence. But the patients are never told that if they go on this heart-lung machine, the pump, they're going to be permanently changed. Bill Clinton was. His whole personality changed. His ability to remember things changed. And in fact, it was written in a book called Game Change, which is about the politics that occurred, about 9 years ago, the last presidential election. So you can read about it. They talk about what happened. And the Wall Street Journal, Melinda Beck wrote an article about it that was prompted by a newsletter that I did on the brain damage. But anyway, the patients, point number two, patients need to be informed about the risks of this surgery. The brain damage is only one of them. And I've never heard of a patient being told ever that this is a known, expected preoperative complication. And I've never heard of a patient who came in, say, with their family and complained to the doctor about the patient after the surgery. I mean, I've heard the stories from the patients, but I've never heard of a doctor who gave a proper explanation about this brain damage to the patient. Like, for example, one of my patients said, yeah, I can relate to what you're saying. My mom went in for bypass surgery, and she used to read a book every day. And since the surgery, she hasn't read anything. Or a lady told me one time, she said, I've married this wonderful man. I've married the amazing man. We've been married for 4 years. He was just a gem. And then starting about 2 years ago, on 4 occasions, for no reason at all, we're sitting in a restaurant and he just stood up and started screaming at me. And this occurred once I read about the brain damage, which was in a newsletter that I wrote. She said, "This I can put it all together now. This occurred this occurred right after he had the heart surgery." I actually got a letter last month from a lady who's married to one of the most famous personalities in the world. Now, I'm not going any further than that because I don't want to identify it. But she said, they had an ideal marriage until about 17 years ago when he had the bypass surgery. And since then, he's been brutal, abusive to me, physically, mentally, and emotionally. And once I discovered this about the heart surgery and what it did to my husband and my life, she said, I understand now. And she said, I want you to know he's getting old. He's still on TV. But she said, he's getting old. And as soon as he dies, he says, I'm going to go back and sue everybody I can get my hands on because of what they did to him and didn't tell me about it. Anyway, I could go on and tell you more and more stories.
Don't you all refer to patients with a syndrome as pump head?
Yeah, it's called pump head or bypass brain. Everybody knows about it. Nurses know about it, but we never tell patients. So I think that's criminal behavior. Then let me just tell you one other story that, again, personally happened to me. One of my patients, one of my very good patients' friends, long-time relationship with me. He was about 90 years old, and his wife, who's quite a bit younger, maybe about in her 60s. Anyway, he at 90 discovered he had colon cancer. And he went in to have the colon cancer fixed. And when I talked to him, I said, look, do as little as possible to get the bowel problem fixed. And I didn't say it, but I wish I would have. I wish I would have told him, don't have the cancer taken out. Instead, just have the bowel diverted and wear a colostomy bag. Because what followed was just an atrocity. What followed is they wouldn't do the colon operation, the cancer operation, until he had his arteries checked out, his coronary arteries, to make sure that he could survive the surgery. Well, the angiogram led to a cardiac arrest, which led to resuscitation, which led to him almost dying. And this has been maybe a year and a half, and the man just recently got out of a care facility and was able to come home, but his life was totally ruined. Well, what kind of prompted me to ask you to put this as a title of the talk today was a paper that was just published, which really addresses what happened to my patient. You can get this, came out March 28th, 2016. It's right here. It's probably violating copyright rules, but here it is. No, it's not, because the first page you can get for free if you look it up on the internet. Mm-hmm. They can't give you the second page. It doesn't matter. It says everything in the first page, which is right here. So you can look this up. The title is Continuing Use of Prophylactic Percutaneous Coronary Intervention. That means doing heart surgery using an angioplasty. The continuing practice of using angioplasty. Let me just read the title. Continuing use of prophylactic percutaneous angioplasty. That means doing angioplasty prophylactically before with stable coronary artery disease despite evidence of no benefit. What this paper is about is that if you go to the doctor, say you need your hip replaced, or in this case you have a colon cancer, or some other elective procedure. If you go to the doctor before the surgeon will operate, in many cases, because as I say, almost everybody has coronary artery disease at that age. It's nearly 100% finding. What they insist you do is have your coronary arteries checked out to see whether or not you will survive the non-cardiac surgery they have planned. Well, what this article is about, let me read the title for you again so you can look it up. It's Continuing Use of Prophylactic Percutaneous Coronary Intervention in Patients with Stable Coronary Artery Disease Despite Evidence of No Benefit, and it's published in JAMA Internal Medicine, and that's March 28th, 2016. What they point out is that we have known, well, actually it's been for 16 years. It was first studied in the coronary artery revascularization prophylactic trial, which was published in 2004 in the medical journals. What they found, where they took patients who had non-cardiac surgery planned, and they either did preoperatively heart surgery or didn't, angioplasty or bypass surgery. The idea being that if you fix the arteries first, the patient is more likely to survive the hip surgery or the cancer surgery. What they found when in this randomized trial is that actually the patients who were treated prophylactically had a 6% mortality, whereas those who didn't have the preoperative heart surgery only had a 2% overall mortality. So anyway, we've known for 16 years that this is a criminal behavior to do this. And this article was published because they had just, in the same issue, done a review of 200,000 patients who are still undergoing this type of preoperative heart investigation and surgery. It's still common practice, as it just happened to my patient and will happen to many of your patients. And plain and simple, even though American Heart Association, American College of Cardiology have officially come out and tell doctors to stop doing these kinds of unnecessary procedures on people with stable coronary artery disease. The doctors won't stop doing it. They just plain and simple will not stop doing it. In fact, in 2007, the American Heart Association and the American College of Cardiology, after looking at what is called the OATS study and the COURAGE study, and there are actually about 28 studies that have been done, and they're looking at these studies and showing no benefit, no survival benefit, and considerable harm to doing heart surgery on people with stable coronary artery disease, which is common practice till today. They came out and told doctors to stop doing this. In 2011, in the Archives of Internal Medicine, they published an article looking at what happened after the heart associations, the two of them, told doctors to stop doing the procedure. And the conclusion of this article, which is found in the Archives of Internal Medicine, is there's no behavior change. They're still doing just as many. I mean, they're changing the diagnosis, you know, from doing surgery on chronic coronary artery disease. They change it to you know, unstable angina or some other made-up thing. I mean, in some cases, it's not made up, but in many cases, it's exaggerated and made up so they can continue to support their hospitals and to support themselves and so on. So nothing's going to stop this, plain and simple, until, like the letter I got this morning came, so till somebody decides to sue, you know, and make a public issue out of it, to sue one doctor or another, and so the public can find out really what's going on. And so other doctors, you know, really, Gustavo, I don't think this is a universal conspiracy. I think it's a conspiracy. I don't think it's universal. I think there are many, 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 many doctors who are ignorant about this, about the cause of coronary artery disease, about the fact that it's reversible, about how you can stop chest pain. I mean, Ornish showed you could reduce chest, Dean Ornish showed you could reduce chest pain in 1991 by 92% in 3 weeks, frequency of chest pain. So it's, you know, many doctors don't know this. Many doctors don't know about the brain damage. They should. They don't know that doing heart surgery for, you know, to get a patient ready for a non-heart surgery, you know, for like a hip surgery, they just don't know. But is that an excuse? I mean, after all, we've been to medical school for 4 years. All of us these days have been trained another 3 years post-medical school education. Why don't we know this? And I don't know whether not knowing is an excuse, but that's what's going on. Now, I do want to add just one other caveat. In fact, I'll take just a couple seconds to make some sense of all this. One thing that you do need to know is that I believe, and there's some question about whether it's true, I believe that you can help patients who are having a sudden heart attack if you do heart surgery. It's a situation where you must get them, they say, from the hospital door to the surgical table within 90 minutes. And if you can do that, and you insert one of those catheters, and you in some way or other disrupt or dissolve the blood clot that occurs, you can make a difference in people's lives, maybe save lives, reduce heart damage, and so on. So that's a given. So if you have a heart attack, you want to get to your hospital as soon as possible. Certainly after 6 hours, it's too late to make any difference. But in the first 90 minutes, you can. So do remember, I'm not telling you all heart surgeries are useless and harmful, just the ones that are done on chronic coronary artery disease, which means old scars. The way you get these plaques is little pimples inside your arteries. They rupture and blood clots are formed over the ruptured pimple, and then scar tissue goes in, and so you have a little scar, and these scars build up, and these are just scars. Those plaques they see on the in the arteries are just old scars. Those are the things they operate on. Those are all healed. I mean, they're of no significance unless they get so big that they give you chest pain. And they have to close more than 70% of the artery before you have any type of signs or symptoms. So what we're talking about is chronic coronary artery disease, treating these old scars. A new rupture, one of those little pimples, ruptures, pustules, new rupture. If you can get to the hospital within and to the operating room within 90 minutes. Likely they're going to do you more good than harm. So anyway, that's my first introduction to what I think is going wrong with the cardiac business. I've known about this, by the way, all the things that I've just told you, I've known about for, probably 30 years. This is not new information. I told you the randomized trial that was published, it was published in 2004, showing that there's worse outcomes when people have heart surgery in preparation for a non-cardiac surgery. This is old news. It just doesn't change because of the fact that people are making billions of dollars, hundreds of billions of dollars doing the wrong thing. And so my last bit of thought for you, after all of that sobering information, is for you to get out of the business, because you're not going to win. You don't want to be involved with doctors and hospitals and pills and procedures. And the only way you can get out of the business is to be healthy. And you can stay healthy by wearing your safety belt, not smoking, learning how to swim, But the major cause of death and disability is the food. Mm-hmm. So the way you get healthy is you fix the problem, which is the food, which is to change the kind of diet I'm trying to teach you. Now, no, I got to end with one more thing. I'm not going to make it personal, but let's just say it's a made-up story. This is a made-up story. Let's just say I personally became very injured and incapable of responding, talking, making decisions, and so on. And my wife, Mary, because of my distress, took me to the emergency room. And in my debilitated state, I'm laying there in the emergency room, and the doctor looks at me and says, let's see, he's 69 years old. He had a stroke when he was 18. I've heard him say he used to have a cholesterol of 340, 338. And because he's a man, I think we need to study his arteries. And I bet I would get heart surgery without a doubt, from an accident that made me unable to communicate. So what I thought about doing, in fact, maybe for the newsletter, when I finally write it, I'll get somebody to Photoshop this for me. I thought about having, I open my shirt, imagine, having tattooed across my chest, do not stint. I will sue. Just because I know.
That's a probability.
Yeah. Just go to the tattoo shop. Do not stint. I will sue. Because otherwise they will. Ladies and gentlemen, they will. This paper proves it. Everything else you read proves it. And the only way you're going to save you and your family is to get out of the business. And that means stay healthy. And there are some things that we can't avoid, like accidents happen sometimes. But a dietary disease is like a stroke that I had at 18, and a heart attack, which my father suffered terribly from. And many of you have friends and relatives who have had bypass surgeries, angioplasties. These are entirely, completely preventable problems.
Exactly.
All right. Well, Gustavo, I'm going to turn it over to you. That was more than I wanted to say.
Dr. McDougall, you said it's something very important, which is just change the eating habits. It's going to be less effort than trying to change the cardiologist's mind.
You're not going to change it.
You're not going to change it.
You are not going to change. You cannot. Upton Sinclair said something like in 1906 in his book, The Jungle, about how you cannot teach somebody something that's contrary to their salary.
Right. You can't. So I could take this pile of medical studies, but I don't think that would make a difference.
Well, the studies are there. I mean, every cardiologist, every heart surgeon
has access to
every internist. I mean, they all have access to this article.
They subscribe to
the article. Oh yeah. So and they may have read it, and they may even be discussing it over the operating table when they're doing your heart surgery, and given 6 reasons to justify their criminal behavior.
Right.
I wasn't going to say that anymore, was I?
Did you have a video or a slide
Well,
that you want to show?
I did. Would you like me to try and show?
Why don't we try?
I will do this. I will explain to you. Let me explain to you. I don't know whether this is going to be worth the time or effort, but let me explain to you how you get a heart attack and why treating chronic coronary artery disease doesn't work. Here's how. First, you have to understand how you get a heart attack. Let's see if we can pull that up. Right. Let's see. Okay. And you do tell me if this is going off. Here's a picture of the arteries.
Yeah.
Okay. You see the top artery. You see the inside lining, which is called the intima. It's 1 cell thick. That intima gets damaged. It gets damaged by products of cigarette smoking, by the foods that you eat, by, as we just heard in the news over the last few weeks, by eating vegetable fats. Omega-6 fats cause terrible damage to those arteries. Anyways, once they get damaged, you get a festering sore, which is in frame 2. The festering sore gets worse. And finally, what happens is some of these festering sores, they rupture. Now, these are little sores. You can see them with a magnifying glass. What I represent here is much bigger than they really are. These are very tiny little sores. And you have 44,000 miles of arteries. So likely, if you're on the American diet, I mean, typically somebody would have thousands of these sores throughout their arteries. But what happens is one of the sores pops, and the gunk inside, the necrotic material, the pustular cells and the fat and the cholesterol, it comes shooting out of the pimple the pustule, like a pimple rupture on a teenager's face. And what that does is it causes the blood to clot. So you get a blood clot, which is labeled there as a thrombus. And that closes off the artery, and that's how you get a heart attack. This was in my book that I published in 1996. So what's that? 20 years ago, I published this in a book called The McDougall Program for a Healthy Heart, showing the same thing. You have these pustules up top frame here. You have these pustules, the little fissure or crack forms, the gunk comes spurting out, and a blood clot forms. That's how you get a heart attack. And that's why if you can get to the operating room within 90 minutes of the onset of this, the blood clot may be fresh enough for them to dislodge it or dissolve it, and as a result, return the flow of circulation to the heart muscle soon enough before the heart muscle dies. But unfortunately, if you wait longer than 90 minutes, certainly longer than 6 hours, the clot is well organized. It's not easy to dissolve, and the heart muscle that lies distal is already dead, so it doesn't help. Now I'm going to show you this video, and I'm going to talk over this video because we weren't able to get the voice to go through, and Gustavo's going to interrupt me if things aren't working out. This is a video from the internet, and it shows you an animated picture of kind of what goes on. Let's see if we can play it. Here you have a picture of the heart and the arteries there. And looking inside the arteries, you see the blood flowing. Those are little blood cells. And it flows without any obstruction. It flows very easily through the arteries. And then what happens, by eating the Western diet, you develop sores inside the artery walls. Now, this material starts out as kind of like pustular material. It's white blood cells and so on. And this video shows these things growing kind of big, but what really happens is that most of them stay small. So you can form scars with these things, but what usually happens is a little pustule you can't see actually ruptures. And as this doctor you're going to see here now is explaining, that the most common reason for somebody to have a heart attack is for one of these little pimples, which has no symptoms at all. It ruptures, and then a blood clot. You see the blood clot forming? Okay, this all happens suddenly, and then what lies distal, oh, that's interesting. I wonder if I can get that back. Previous slide, yeah. What lies distal dies. So you see this is a sudden rupture of a plaque that forms a blood clot. All right. Well, how you get chronic coronary artery disease is you have a lot of these pimples rupture throughout the body, and these pimples don't all completely close the artery. Some are just small pimples, and you form a small blood clot, and then the body goes in and replaces that blood clot with scar tissue. Well, you get repeated clots that form over the top of previous scars until it builds up to the point where maybe you get 70 to 90% of the artery closed. Now, what you're looking at here is an angiogram, and you see the arrows are pointing at shadows, and these shadows are old scars. These are plaques. You see those shadows? Okay, those are the result of multiple previous plaque ruptures, which formed blood clots, and the blood clots were replaced by scar tissue. And this is what the doctor finds when they look inside your arteries with the tube by doing an angiogram. Now, these look scary to the patient, but you have to realize these are just old scars. They're history. Nothing's going to happen with them. There's no real problem with these scars at all, except they may get big enough to give you chest pain. However, if somebody finds these scars in your arteries, and how often will they find them? Remember, I gave Bill Clinton, our 42nd president, as an example. 80% of men his age, 58, when he had his heart attack, with a cholesterol that's average, his was about 235. 80% of men have these scars. So, you know, if somebody goes poking around looking for things, they're going to find these, and then they're going to take and show you these pictures. You know, the way we were taught to do it, actually, this is part of our formal education. And doctors today are taught it too. Remember, my son just went through a medical school, and I'm a professor at several universities, and I teach medical students, and they're taught all the same thing. What you do, the way you sell this procedure to a family is you do this. You take the wife, let's just say it's a man, the husband has a heart attack. You take the wife into the next room and you say to the lady, you say, this is your husband's heart. You see these blockages that I'm pointing out here? She says, yeah, I see them. That looks really terrible. And he says, yeah, he says, that's so terrible. We have a name for it. We have a name for these blockages, ma'am. What do we call these blockages, ladies and gentlemen who are listening? They're called widow makers. That's how we sell them. That's the pitch to the patient. They're widow makers. They're old scars. Anyway, how can you turn down a widow maker? And then what you do is you wait for the wife to go home. This is part of our sales pitch that we're taught to sell this procedure to people. So we wait till the wife goes home, and we go back and visit the husband laying there just after a heart attack, and you know, we show him the pictures too. And doctor says to the husband, to the father, he says, you know, I met your kids. You have a wonderful wife, beautiful wife, and the kids are growing up. They'll go to college and get married. You'll have grandchildren. But, you know, I must tell you that unless you agree to this procedure, you will never see sunshine again. Isn't that funny? But I want to tell you, that's what they do every day.
Well,
so again, my answer to you is get away from these people.
Get away.
It goes on and on and on, and unfortunately, it's the money. It's just the money. Some of these procedures are necessary. Some people benefit, but the American College of Cardiology, the American Heart Association, all honest doctors, the scientific journals are absolutely clear that the treatment of chronic coronary artery disease, the old scars, with surgery is ineffective and does horrible harm to people, financially, physically, emotionally, mentally, and so on. Everybody knows this. But until somebody takes the trouble to sue in a public manner, like the person I told you who was married to a very famous personality, boy, if she follows through on the emails she sent me, what she plans to do when her husband, who has been abusive to her for the last 17 years.
All right.
Change things. It'll take something like that.
It will take something like that, for sure.
You would think brain damaging our 42nd president would have been enough. Bill Clinton is functioning quite well now, but he knows, he himself knows, and other people know that he is not quite as articulate and as intelligent as he was before his heart surgery. He's good. And by the way, I watch him a lot, and I have great admiration for this man. Don't take that in a political term, but what I see him doing is absolutely phenomenal. But he was damaged during his surgery, and it was published in the Wall Street Journal by Melinda Beck based on some work that I did. Anyway. You got any questions? Got any questions?
We have a lot of questions, Dr. McDougall. I don't know if you can answer all of them, but I have someone that asks, how can someone find a plant-based cardiologist in their area? Is there a way?
There are a few. I guess you'd have to call around.
Right.
I never make recommendations for other doctors. And the reason I don't, even though many of them are my friends and they teach similar things to what I teach, they don't always teach the same things I teach, or I don't know what's going on. So you just won't find me telling you to go see Dr. So-and-so and Dr. So-and-so. But you could call around. Doctors get reputations when they do crazy things like tell people to eat well. So you might be, but I tell you, much better is this. A much better advice, not just with looking for a cardiologist, but for an obstetrician or a plastic surgeon or anybody you're looking for. Just to go find somebody who's really good at what they do. If you want plastic surgery, you want to find an artist. You don't care whether they smoke cigars. You don't want them drunk in the operating room. You don't care whether they have a fat belly. You know, it's just like, God, again, I worry about getting too personal. But when one of my family members needed to have some surgery, I looked all over the Bay Area for the best doctor to do this surgery. And it took me a while, but it wasn't an impossible job. And I located the doctor who does the best of this particular kind of surgery that was necessary for one of my family members. And I went down with the family member and another relative, and we talked to the doctor, and the doctor was about 80 pounds overweight. But this was the best surgeon to do that particular procedure in all of the Bay Area, as far as I knew. So I hired that doctor. I happened to also give him a bag of Dr. McDougall's right foods and told him if he ever needed me, I'd be glad to come and help him. So, you don't really want to find a doctor necessarily that eats well. I've already told you how to eat well. It's on my website. Dr. Esselstyn will tell you how to eat well. Dr. Ornish will tell you. You can read the book.
And it's here.
It's all there. This is so simple. You don't need somebody else to tell you. But if you need a doctor, you're having a baby, get a doctor who's in line with your thinking about how you should have your baby delivered, or you should deliver your baby. You want to get a doctor who would be the best expert if a complication developed. You don't care about that doctor's personal habits or whether he knows anything about a potato versus a pork chop. I mean, that's not important. So my recommendation is find a doctor who can meet your needs in terms of what kind of skill, service that you need, and take care of your own food business.
All right, very good.
Well, I do want to add something. We focused on surgery and so on with artery disease. I also should add that in addition to a good diet, when I treat people with heart disease, I also judiciously use medications. I will give a baby aspirin usually and enough statin drug, usually pravastatin, to lower their cholesterol below 150. I'm a real doctor, ladies and gentlemen. I am not an alternative medicine doctor or a holistic doctor. I'm just a regular board-certified general practice doctor, and I use all the tools available. And so I do use medications in people with heart disease, and you can read about that on my website.
Right, and talking about that, I had several people ask about high triglycerides, and if they're eating a plant-based starch-centered diet like what you recommend with no added oils, if they should be concerned about high levels, and what they can do to lower them.
In our publication, which is in October 2014 in the Nutrition Journal, we looked at triglycerides, and over a 7-day period of time, on average, they stayed the same. But I would tell you that some of the patients in that group came in with very high triglycerides, like 600, 900, 1200, and they dropped their triglycerides often 300 and more points. I will also tell you that some people, let me just tell you my guess on this thing. If you take average people who eat the American diet, who have normal, quote, normal triglyceride levels, and you put them on a program like I recommend, where they eat a lot of food and a lot of carbohydrate, I think on average, the triglycerides go up a little bit. But in our study, it shows they don't go up at all. But I think that's because we had such profound benefits in people with really high triglycerides. Triglycerides are fats in the blood. They are produced by the liver, usually. And if you eat a lot of food, they're going to go up. If you eat a lot of carbohydrate, particularly simple sugar, they're going to go up. In time, they go down. Almost every patient that I've seen who's stuck with the diet, lost the weight, has made their triglycerides normal. It may take some time and associated weight loss. Remember, when you're losing weight, triglycerides are coming out of your body fat, going into your blood fat. So you should expect them to go down. You should also understand the treatment of triglycerides with gemfibrozol. Anyway, there are other names for it. There are various kinds of drugs that are dedicated to triglycerides. These drugs are very dangerous, and I will never prescribe them. Well, when I say never,
right?
You know, I just there's something I don't prescribe. There's always exceptions. So you should not work on your triglycerides by anything but a good diet and associated weight loss, and exercise will also lower triglycerides. And giving up the simple sugars, even fruit and fruit juice, will cause triglycerides to tend to be higher. Right.
All right. A couple of people are asking this question. Actually, Sean says, "What about carotid? Is that pronounced carotid?
Carotid arteries.
Yeah. Here he says that his doctor says that he has a 70% blockage in his left artery, and he wants to operate on, but he doesn't want the operation."
You know, I have reviewed this science many, many times, not just recently, but this is my memory, is that people who have asymptomatic carotid artery disease should not be operated on. People who have had TIAs or strokes, then you can show a benefit from endarterectomy, which is where they scrape the artery out, or whatever other procedure they're doing. So I think you should take the trouble to go to the internet, to read the research, which is an extremely controversial area. And that controversy, again, has been going on for over 25 years. I've been reading about it. And my memory and conclusion is that surgery is not beneficial in people who have asymptomatic carotid artery disease. And even if the carotid artery closure is 70%, I do remember some people arguing if it's greater than 90%, then they have justification for surgery. But I don't think that's true either. So make sure the person who's asking the question takes the trouble to pull up the studies and to sit down and discuss the studies, because it's all just like this paper here. You know, it's all easy to read. I mean, it's clear. And if you pull up a couple of these papers, even if you have to go to the library to get them, you just plug into PubMed or Google, put in endarterectomy and surgery and controversy. Throw in the word controversy there, and you'll pull up probably hundreds of articles, and certainly dozens who discuss the controversy about doing this procedure. So you have good reason for asking this question.
All right, very good. So I have a dad that asked a question of his son is studying to be a cardiologist. He said, "Is it possible to actually make a living as a cardiologist recommending diet?"
Okay. This is the data that I looked up a few years ago. Is if you are an interventional cardiologist, in other words, you pass these tubes, you do these percutaneous coronary interventions, angioplasties. If you're an invasive cardiologist, the average income is $500,000 a year. If you're a non-invasive cardiologist, the average income is $250,000 a year.
Mm.
So yeah, his son can be a non-invasive cardiologist, or some of the cardiologists I work with who believe strongly in a good diet, they still do some surgical procedures. And hopefully they're doing them in patients where there's a good indication. But I have no doubt that their mixed practice is predominantly supported by the surgical part, not the, let me sit down and talk to you for an hour about your food part.
Mm-hmm. Right.
Yeah. Yeah, I have some friends who are non-interventional cardiologists, but most see, when doctors go to trade school, students go to trade school, which is medical school. It's a trade school. You learn a trade. These schools are dedicated to teaching you to join an occupation that is highly successful. That's what their job is. Their job isn't really to teach you. I mean, they may say it is. Their job isn't really to teach you how to improve the welfare of humanity. If it was their job, medical school's job, then they would be teaching about nutrition. But instead, except for the students, residents, medical students who have the opportunity to come to my program, where they get a full education over a month period of time, except for those very, very few students, the rest of them are fully dedicated on learning how to do colonoscopies and look for polyps. Even though, remember, the Canadian guidelines from the Canadian Task Force on Preventive Medicine came out about 2 months ago and said, no more colonoscopies, no more for screening for colon cancer. These doctors make a couple of grand by doing these. So they're taught how to do these very profit-oriented procedures in these trade schools called medical schools. And very few doctors go into general practice because you don't have a gimmick,
right?
To buy the big office and the Tesla motor car and your airplane and your sailboat, and to put your wife in or your husband into diamond rings. You're taught to learn an occupation that brings you great wealth. Damn the patient. No, that's probably, people don't like me to talk that way. But the patient is secondary.
Right. Well, it's
and I know they don't think that way, Gustavo. I know the doctors in the medical schools, it's not like, but it's just money drives everything in the world.
It does. It does. And we think that just because it's a doctor that they are somewhere above,
right,
close to being a god, and that they only care about our health. And at some level, yes. But
you should treat a doctor just like you would treat a used car salesman or the person who comes to your house to fix your plumbing, because they're the exact same people. They're the exact same people, and they have the exact same motives. But you don't, as you said, you treat doctors like they're next to God, and this isn't good for patients, and it's not good for doctors too, because when God doesn't deliver perfection, what do we do to God? We sue him. And because of these high expectations that doctors have allowed to be created, you're always going to get a perfect baby, and if it doesn't turn out perfect, the doctor gets sued.
Right.
You're always going to get, you understand. So it's not fair to anybody to have this unrealistic expectation of physicians.
Yeah, it is unrealistic. Dr. McDougall, what about atrial fibrillation? My doctor wants to put me on blood thinners, this patient says, and I'm resistant. I am on a plant-based diet. Is there any specific dietary recommendation you have to correct this and to avoid blood clots forming?
Yes. There's a lot you need to learn. And again, on my website is an article about atrial fibrillation that I wrote. It could be greatly updated, and more information could be told. But let me give you some high points. Atrial fibrillation is caused by the diet. The Framingham study is some of the best evidence on this. And what happens is not the big arteries, but the little arteries, the microvascular circulation of the heart gets damaged, and that damages the nervous system of the heart. And so you go into this very irregular rhythm. And this rhythm on occasion needs to be controlled because it's too fast. The rate is too fast. If the rate is over 110 beats a minute, then people need to be put on medications that slow the rate, like beta blockers or digoxin. I was trained to use digoxin. The other thing that happens is because of the atrial fibrillation, which is where one of the top chambers of the heart is just contracting like a bag of worms. I suppose I can see that. What happens is the blood has a tendency to clot, and that blood clot can be dislodged and go up to your brain, give you a stroke. So there's a small, much smaller than has been advertised. There's a small risk of having a stroke if you have atrial fibrillation. And there is a small reduction in that risk if you're put on blood thinning drugs like Coumadin was the traditional one, warfarin, rat poison. That's what we traditionally used. Now there are new drugs like Xarelto, which act differently, which show similar, if not better benefits, and are possibly safer. I mean, there's a lot of money that's being used to advertise the benefits of these new blood thinning medications. And so, of course, the truth is being biased. But my read of it is these medications are probably the better choice over Coumadin for convenience and safety and effectiveness. But again, don't hold me to that. I'll change my opinion on that. But there's something this person, man or woman who just asked this question, needs to do right now, is they need to go to the internet, maybe Wikipedia, and they need to look up something called the CHADS score, CHADS. It may be called the CHADS 2 score. Anyway, this is a rating system which helps doctors guess whether using these blood thinners will do more harm than good to a patient. There are other types of schemes that have been invented which help doctors predict whether or not these medications will result in more benefit than risk. The CHADS is a good place to start. Big letters, CHADS. And what they generally say is that healthy people do better without these medications. Sicker people, you can show more benefit in sicker people by using these drugs. Sicker meaning they've had a stroke, they've had diabetes, they're older, and so on. So doctors use these scoring systems to help guess whether you're going to do more good than harm. But excuse me, ladies and gentlemen, these are small benefits. And these are only guesses. But those are the tools we have. They're crude, they're available. In my patient practice, when I take care of my patients, I rarely put them on these drugs because most of my patients are really healthy.
Right.
And if they weren't, and I felt for their benefit or for mine, remember, I'm at risk of getting sued if I make a wrong decision. I would probably use the newer type of anticoagulant blood thinning drugs like Xarelto. Fortunately, I don't come up to that situation very often, but I do also put them on aspirin, whether it does any good or harm when they have atrial fibrillation. It's probably more treating me than them. Anyway, it's not an easy, just one pat answer, and right. I hope I gave you enough information to at least start looking into it, and then sit down with this information, the CHADS score system, or other systems that you find that evaluate risk and benefits, and get some real numbers, like, what are the actual numbers in terms of my risk of stroke, whether I do or don't take this medication, because the numbers are there.
Right.
And of course, eat a good diet.
Well, Dr. McDougall, I think it's so important to remind people that there is a wealth of information on your website, and many of them forget, or we're too busy to go visit that website, but they can sign up for the free newsletter. There are videos. Just tell us a little bit about all that people can find.
Well, there are. We should actually do somehow. I should figure it out on the webinar.
Right.
How to get the website up there so I can kind of take people through my favorite parts of the website. Like there's a search engine where you just put atrial fib in, and you will get. You see the search up there. You'll get. You put atrial fib in, you'll get that article I talked about, and so on. Colonoscopies, you'll get articles I've written on that. So use that search engine.
Yes, you can type here.
Yeah.
Right.
You can also use the education part and look under hot topics. You have to go past the advertisements, and then you'll see there, then you'll see Dr. McDougall's newsletter, May 2012 was probably the article.
Right. This is an incredible tool, everybody, to use. Just type here what you're looking for. You can also see the archived webinars.
We have there. Yeah, people ask, can I see this webinar? I missed it.
And tell us about this, Dr. McDougall, that is coming up soon.
Oh yeah, on May 13 through 15, which is just like 2 weeks away, we have a meeting in Santa Rosa, California, which is a three-day educational meeting where we have all the top dogs, so to speak, speaking. That be myself, Mary, Doug Lyle, Jeff Novick, and our regular staff will be talking for 3 days. It's the least expensive, most accessible program we have. I don't see the cost there, but it's really quite inexpensive. It includes the meals and so on. Gustavo's going to be there. A lot of our friends will be there. We have well over 100 people already signed up, and I don't know how many rooms we have left. So if you plan on going, I would get on the 800 number real quick and make your reservation. So we have that coming up May 13 through 15. We have some 10-day programs coming up in June, I believe. We have a full boat, so don't even bother. We're taking a full boat of people to Alaska in June on our McDougall adventure. The next adventure after that is in January 2017 to Kauai. We'll have a whole bunch of people going on that vacation. Amazing trip. We're going back to the same place we went last year, the Sheraton, because it was such an overwhelmingly positive experience. And then we have the advanced study weekend coming up in September, where we have Brenda Davis. And I'm having a whole bunch of young doctors like my son, Craig McDougall, Matt Letterman, Anthony Lim, who's the doctor who helps me out now. A whole bunch of the young doctors. We're going to have them discuss how their practices are going and having a panel. And I'm going to be asking questions, and T. Colin Campbell will be there. I don't know whether he's going to join us on the panel or not, but he'll be there. And we have a whole bunch of really great, interesting speakers for the advanced study weekend, which I believe is 16th or 18th of September.
Right. Yes.
We have a lot of things coming up.
Well, very good.
But do remember, everything you need to know is free on the website.
It is. Yeah. All the information is there.
And I should also mention the new book, The Healthiest Diet on the Planet.
Oh.
Yeah, that's coming along much better than I'd hoped, and that'll be out in September.
Wow. Oh, that's great.
Yeah, that'll include Dr. McDougall's Color Picture Book, which is the best educational tool there is, and photographs of many of Mary's recipes. That's the first time Mary has ever had her recipes photographed. And we're right in the middle of finishing the editing. So the pub date on that book is in September.
Oh, wonderful. All right.
There are probably 7 other things I wanted to tell you. But
okay. Well, I know that, Dr. McDougall, we're going to do another part 2 of this topic, right? Because
when I do the newsletter on cardiologists acting criminally, which I didn't, as I said, I didn't have a chance to do because Mary told me, I got my marching orders. She said, you need to write about SIBO, which is the bacterial overgrowth that occurs in the small intestinal bacterial overgrowth. And what it is, it's people are going to the doctor with bowel problems and feeling bad. And instead of telling them they're crazy, which we did when I was a young doctor and put them on tranquilizers, or tell them that they have hypoglycemia, which we used to do about 30 years ago, or giving them some other excuse as to why they feel bad, they're being told these days they have overgrowth of bacteria in their small intestine. That's the new pitch as to why they feel bad, which is not true. And that's not why they feel bad, is because they eat the rich Western diet or some variation of it.
Right.
And the way they get well is they eat like we teach. And the other thing that you'll learn about in the newsletter is a whole bunch of people are on these proton pump inhibitors, Prilosec, Nexium, et cetera. And that stops the acid production in the stomach. Well, the stomach acid kills the bacteria that go into the small intestine. So if you take these antacids, you get overgrowth of bacteria in your intestine too. But again, all this, the indigestion, the need for the medication, et cetera, I mean, all this is tied into the diet. So you want to fix the problem, eat a starch-based diet with fruits and vegetables, and don't go messing around with these food map diets. And there's a whole bunch of diets out there that's supposed to somehow control these bacteria, and they're just they're half-truths, to tell you the least.
Right, and again, they're driven by money.
Well, yeah, maybe, or egos.
Or egos.
Yeah, I don't know.
Well,
anyway, that's what I'm going to do. When we get off the phone, I'm going to finish that newsletter.
All right, great. Well, thank you, Dr. McDougall. Everybody knows how busy you are, and we appreciate that you give freely of your time.
Well, I appreciate it too, and I can't tell you how much I enjoy talking to you and have you moderate the discussion. I get an email at least once a day just talking about what a nice job you do.
Good. Well, thank you. I have to say that for being just about 69, right? The type of schedule that you have, I think that some 25-year-olds would have a hard time keeping up with you.
Well, Mary and I talk about this a lot, because Mary will be 70 actually in
right.
3 days.
I know, right? Yeah.
So, Mary and I talk about this a lot, about how we should retire. But as soon as we say that, she looks at me and I look at her, and we say, what would we do?
Right.
What would this is all we do is work. We know nothing else.
Life. You have a mission. You don't have a job.
Well, it's been our life, and we have no intention of retiring. We'll work as long as we're capable. Jeff Novick, our good friend, as you know, he says when I get to be 90 and become incompetent, he says he's going to tie a rag around my wrist and just pull the string every once in a while, so the audience knows I'm still here.
Yeah.
But right now I'm in good shape, and
yes, and I have to say something, because not many, but every now and then I get someone who emails me and says that to please get some lighting or something, because actually this week someone said that I don't look healthy. So another week it was you.
Yeah.
We're okay. The skin is okay. We just don't have a makeup artist right here.
Well, the other thing is I've finally got, I think, my computer high enough.
Right.
So that I'm not looking down at my computer all the time. And that helps too.
It's
but if you have any doubt, ladies and gentlemen, the date is May 13 through 15. You come and see Gustavo and I in person.
We will, we'll post.
In person in Santa Rosa, California. We'd be glad to give you a hug.
You can see the skin, and you can, touch. It's real. Yeah. Anyway, we know your age, Dr. McDougall. So let's finish it with a little contest. How old? Do you know how old I am? How old do people think I am?
I hope
they don't say it's 75 or something.
No, you're 27, Gustavo.
Oh yeah. Okay. Well, very good. So I'd have to say I'm 52, and I hope I don't look like I'm 52. But
you look great. And you know what? I just ran across a before picture of you, and you should take one of the before pictures. And you will see a much older man who is almost 80 pounds heavier.
Yeah.
And so
I had a hard time keeping up, and I just have endless energy today from the time I get up to go to bed. It's wonderful, and I have that to thank you and the Starch Solution.
Starch Solution. It's the best book, even though the new book's coming out and may become much, much more popular. There's some reasons it might. The Starch Solution will be one of my favorites always.
Yes, it is.
It's becoming much more popular. That's the thing is we've paid off our advances on that book, and we're starting to get sizable checks because the sales. And if you go to Google Trends and you look up the Starch Solution, you'll see that the sales are increasing beyond anybody's expectation, just from word of mouth.
That's great.
That makes us pleased.
I think that little by little, we are all making a difference, and I hope that everybody on this call, in this webinar, that you all feel part of the mission to bring your friends and family to watch these webinars and to get the information out there.
And also, don't forget, I'm only 69. I need a little stimulation. If you have any reasonable adversaries, just email Gustavo.
Yeah.
And as long as they're not going to do things that are silly, like, lie or call us names. I mean, if they want to enter an honest discussion and maybe point out some places where I've exaggerated or not told the whole truth, we'd be really thrilled. It would add to the entertainment of the webinars.
Oh yes.
And maybe I would wake up a little bit. So we can make this a lot more fun if you want to bring in some controversy, or if you just want to somehow or another talk to one of your expert friends, doctor, scientist, or whatever, and maybe they could give us a short paragraph that you could send to Gustavo, and they don't even have to talk to me, and I will try and give a decent answer to their concern. Our goal is to get the truth out, and
it is.
Even though everybody has a different truth, mine has survived the test of time. I've been in medicine almost 50 years.
And it hasn't changed in 44 years.
Not only has my wife not changed, I'm still married to the same one for 44 years. What I've been teaching has been the same if you go back and look.
Right.
It's not changed, because the truth is simple and easy to understand. There is truth out there, I believe.
Well, thank you again, Dr. McDougall, and we'll see you next week, hopefully.
I will be here next week. That Dr. Doug Lyle, we're going to give him a couple of days off.
We'll have him, yes, exactly.
We'll have him again soon.
All right. Well,
right.
thank you, everyone, for logging in, and we'll see you next week.
Bye-bye.
Bye-bye.